Ethical Issues in Palliative Care, a presentation by Sandra Goodhead and Melanie Bradshaw, nursing students at the University of Texas Health Science Center School of Nursing. Let's start by talking a little bit about ethical dilemmas in healthcare. Oftentimes, there are barriers that stand between us and our clients receiving the best possible care. We know that every day, healthcare providers are faced with situations that challenge their moral principles. In addition to these challenges, issues such as employee fatigue and burnout contribute to putting patient safety and comfort at risk. How then can healthcare workers overcome these issues in order to provide their clients with high-quality care that also meets the ethical standards of practice that we all agreed to abide by when we obtained our licensure and/or certifications? Where is the breakdown? Topics to be discussed throughout this presentation include: what are burnout and ethical distress? What are the factors that contribute to both? Commonly recognized ethical principles, a review of healthcare ethics, an ethical case study, a review of Maslow's hierarchy, the 4 R's for preventing ethical distress, and tips for managers and ideas for implementation on the palliative care unit. Let's start by looking at a case study. Mr. J has been a patient in the palliative care unit for the past 4 days. He's an 86-year-old male, World War II veteran, with a 2-year history of dementia and newly diagnosed small cell lung cancer with metastasis to the femur. His care originated in the emergency department with shortness of breath, and his respiratory status became so compromised that he required intubation and was admitted to the ICU. Although he is no longer on the ventilator, he has become increasingly confused and agitated. His nonverbal behaviors suggest he is in pain. His daughter, who is his power of attorney for healthcare, requested that the goals of care shift from a plan for chemotherapy to keeping him comfortable, and as a result, he was transferred to palliative care. Tom, a nurse on the palliative unit, is working his 3rd 12-hour shift this week. In order to pay back his mountain student loans, Tom decided to pick up extra shifts for overtime. Today, the unit is down a nurse and a nursing aide. He faced an hour commute on the way to work due to a traffic accident. What about Tom and his working environment could potentially set him up for ethical distress, and how would this affect Mr. J, his client? We'll get back to our case study in a little while, but keep this in mind as we will talk more about how personal and professional constraints can impact our ability to provide quality, ethical care. Now let's talk about burnout and ethical distress. First of all, what is ethical distress? This concept arises when an individual, in our case a healthcare worker, is unable to act on his or her ethical choices, or when personal and/or professional constraints interfere with the individual acting in the way he or she believes to be right. For example, not being able to meet the ANA codes of ethics such as autonomy, beneficence, non-maleficence, justice, and paternalism. So what exactly is burnout? Well, in his October 2015 report, The Epic Within, Addressing Physician Stress and Burnout, Dr. Eugene V. Boseban shared how stress and burnout among healthcare providers is an international problem that occurs due to a variety of factors. He defined burnout as a syndrome of depression, emotional exhaustion, and perceived low personal achievement that leads to decreased effectiveness at work. It exists in both the work and the school setting. Dr. Boseban went on to explain that burnout not only happens with physicians, but everyone from students to aides, nurses, managers, and so on. It should also be noted that a healthcare provider who is experiencing burnout is at risk for ethical distress. Factors that lead to burnout are fatigue, financial stress, a difficult home life, staff shortage, and many more. Next, let's find out why ethical distress can be a problem in the healthcare setting. As healthcare providers, we have an obligation to uphold ethical principles when providing care to veterans, their family members, our colleagues, and the community as a whole. You probably remember ethics as one of the fundamental nursing priorities that we were taught in school, but little is talked about what affects the proper execution of ethical practice and what factors lead to ethical distress and our quality of care provided, such as burnout. We already know that burnout can lead to situations in which healthcare providers find themselves in ethical dilemmas. However, it's critical to remember that burnout or not, our first duty is always to the veteran. Reviewing the basics of healthcare ethics and examining our potential for burnout can prevent and/or alleviate ethical distress. Now let's take time to review healthcare ethics. What are ethics? Well, these are the principles or standards that influence our behavior and decision making, which are based on experience, religion, education, and culture. So, what are some commonly recognized ethical principles? First, having respect for others. Having respect for the veteran's inherent dignity, worth, and unique attributes, which includes the ethical principle of justice, is important to remember. Commitment to the patient. We must remember that our patient includes not only the veteran himself or herself, but can also include his or her family, our community, or a specific population, such as all veterans being served at the VA. This includes the principles of autonomy, beneficence, and non-maleficence. Advocacy for the patient. Healthcare providers should promote, advocate for, and protect our patients' rights, health, and safety. Accountability and responsibility. As care providers, we have a moral and professional obligation to provide health and provide optimum care to our clients and their families. This includes the ethical principle of fidelity. We also have a duty to ourselves as well as to others. This means that it's important for us to maintain our own personal health, professional competence, moral integrity, as well as personal and professional growth. Stop for a moment and think, what have you done this week to take care of yourself, either personally or professionally? Contribution to healthcare environments. We all have a duty to provide an environment that is conducive to safe and quality care for our clients. And lastly, promotion of community and world health. As healthcare providers, we have an obligation to protect human rights and reduce health disparities, remembering that health is a universal human right. Now let's review some broader principles of healthcare ethics, starting with advocacy. Advocacy is the act or process of supporting patients by preserving human dignity, patient equality, and freedom from suffering. The role of an advocate requires that we act as communicators, liaisons, educators, interpreters, and caregivers. For example, a healthcare provider is sitting by a patient's hospital bedside when a nurse comes in to change a dressing, already wearing gloves. You insist respectfully that the nurse wash her hands and don new gloves. This is advocating for the safety of the patient. Beneficence. This, simply put, is doing good for the client. It means having compassion, taking positive action to help others, and desiring to do good. These are the core principles. For example, an elderly patient falls at home and has a fractured hip. Upon arrival to the emergency room, the nurse acts quickly to provide pain medication as soon as possible in an act of beneficence. The thought to always do good seems so basic, but unfortunately it's easily forgotten. All healthcare providers start out having a deep desire to help others and improve quality of life, but as ethical stress and burnout build, we can lose focus of this basic core principle. Non-maleficence. This, simply put, means to avoid harm or hurt. It is the core of the medical oath and of nursing ethics. Often in modern times, non-maleficence extends to making sure you are doing no harm in the beneficent act of using technology to extend life, or in using experimental treatments that have not been well tested. For example, when an elderly patient is giving consent for hip surgery, we want to make certain that the patient is alert enough to understand the risks and benefits of the procedure. We must balance the beneficence of providing narcotics quickly with the possible maleficence of obtaining a consent when the patient does not have the capacity to make the decision for surgery. Fidelity. This principle requires that we be loyal, fair, and truthful to our clients, and that we are dedicated and act as advocates for them. It refers to the concept of keeping a commitment and is based upon the virtue of caring. For example, a patient asks the nurse not to reveal the fact that she is dying or give her diagnosis to her family. The nurse asks why she does not want her family advised. The patient explains that her family is very emotional and has stated that they would do everything to keep her alive, even if it required long-term mechanical ventilation. The patient has explained multiple times that she does not want mechanical ventilation. The nurse recognizes that keeping this information in confidence between herself, and the patient, while supporting the family, is an example of exercising fidelity. We must always remember that the veteran is our number one priority. Their friends and family members' concerns follow only after we have followed the wishes of the veteran. This is also advocating for the veteran and what he or she wants, not what we may think is best. The patient-provider relationship is of utmost importance in healthcare. If our patients cannot trust us to follow their wishes and to remain loyal to them, then we are not providing ethical care. Justice. This principle is derived from the work of John Rawls and refers to an equal and fair distribution of resources based on analysis of benefits and burdens of decision. Justice implies that all citizens have an equal right to the goods distributed, regardless of what they have contributed or what they believe in spiritually or who they are culturally. For example, a hospital organization wishes to donate low or no-cost pediatric dental services to the community. There are currently openings for 45 children per month. The principle of justice requires that the organization create a fair method that is free from bias to determine which children will receive these services. Think for a moment about our current healthcare system. Although all Americans are supposed to have access to healthcare, are there still not disparities in that access based on income, services available, etc.? When a veteran comes to us for care, we have an obligation to provide equal, high-quality care, regardless of their background, culture, religious beliefs, mental status, etc. Paternalism. Doctors often make decisions about diagnoses, therapies, and prognoses for their patients. Based upon his or her belief about what is in the best interest of the patient, the doctor can choose to reveal or withhold information from the patient in these three important areas. This principle is heavily laden as an application of power over the patient. For example, a patient has repeatedly voiced fear over receiving a diagnosis of lung cancer, as he believes that this is a death sentence. His primary care physician decides not to reveal the diagnosis to the patient after he says he would kill himself if he found out he had lung cancer. Paternalism can be a bit tricky. This is the decision we make on behalf of the best interest of the patient. Think about a time where you thought about a type of therapy for a patient. How did you go about choosing that therapy? Were there negative effects? Did the benefits outweigh the risks involved? How did you choose to talk to your patient about their diagnosis, a new medication or therapy for their illness, or that their condition was terminal? Let's review our case study again. Mr. J has been a patient in the palliative care unit for the past 4 days. He's an 86-year-old male World War II veteran with a 2-year history of dementia and newly diagnosed small cell lung cancer with metastasis to the femur. His care originated in the emergency department with shortness of breath, and his respiratory status became so compromised that he required intubation and was admitted to the ICU. Although he's no longer on the ventilator, he has become increasingly confused and agitated. His nonverbal behavior suggests he is in pain. His daughter, who is his power of attorney for health care, requested that the goals of care shift from a plan for chemotherapy to, quote, keeping him comfortable, and as a result, he was transferred to the palliative care unit. Tom, a nurse on the floor, is working his third 12-hour shift this week. In order to pay back his mounting student loans, Tom decided to pick up extra shifts for overtime. Today, the unit is down a nurse and a nursing aide. He also faced an hour commute on the way to work due to a traffic accident. What about Tom could potentially set him up for ethical distress? Thinking about the case study, what personal issues is Tom facing that could contribute to the ethical distress? What about his fatigue from working so many shifts in a row? What about his financial burden? What about the stress from traffic on his way to work? We've all faced that driving to the medical center. What professional issues could also contribute? The unit is short-staffed, so he has to work harder, which puts patient safety at risk. He also may not feel like he's getting paid enough to do all the work that he has to do. Can you think of any others? How can Tom assure that his patient, Mr. J, receives the best possible care, including safety and comfort measures? Well, he can start by remembering his commitment to fulfill the ethical standards of healthcare providers. He can ask for help from his supervisor, and it's important to leave personal issues at the door when he comes in for work. Tom and his supervisor should reflect on how to correct these situations in the future that cause ethical distress. If Tom is facing burnout, what can he and his manager do to help alleviate the problem? Both employees want what is best for the patients, so they must work together on a plan of self-care and implementing changes on the unit that can address these situations. Now, let's personalize the situation. What if Mr. J, the patient, was your loved one? What if it was you? How would you want to be cared for? Would you be willing to excuse Tom for leaving you in soiled briefs for hours, or not transporting you back to bed just because Tom was having a bad day? Here is a diagram of Maslow's hierarchy that you have probably seen before. Notice how the most important needs, the ones that form an individual's foundation of self, are at the bottom. None of the other needs can be met until this foundational level of needs is met. A key aspect of the model is the hierarchical nature of human needs. The lower the needs in the hierarchy, the more crucial they are to survival, and the more a person will tend to abandon the higher needs in order to pay attention to sufficiently meeting the lower needs. For example, when we are ill, we care little for what others think about us or if we have a connection in our communities. If we can't breathe, having all the friends in the world really isn't going to help, is it? All the patient wants immediately is to feel better. Maslow called the first four needs D needs, as they are triggered when we have a deficit. This is the key principle to Maslow's theory, that the higher needs we have cannot be met until we meet the needs on the bottom of the pyramid, the basic physiological needs. Physiological needs have to do with the maintenance of the human body. If we are unwell, then little else matters until we recover. These needs include food, water, shelter, and sleep. These items are also critical to good health. Freedom from pain could be added to this list, as we know that patients who are suffering from pain often do not get the sleep they need or feel like eating or taking in fluids. Safety needs are about putting a roof over our heads and keeping us from harm, but it also means psychological safety, not just physical. How safe and secure do you feel when you don't have a job, don't have a place to live, don't have much or any family, and have poor health? These needs can be addressed once the basic needs of survival are met. Belonging needs have to do with our feeling like we belong to something bigger, that we have a sense of belonging to a community or family. We see this a lot with veterans and their desire to be with other veterans because there is a sense of understanding between them and a shared core of values. Simply being at the VA can provide a sense of belonging to the veteran. Esteem is how we feel about ourselves and how we perceive that others feel about us. Many of us would like to be well liked, to be respected, and to be seen as a unique individual. This certainly is not of great importance if one is hungry or is in pain. And self-actualization needs are to become what we are be capable of coming, which would be our greatest achievement. Few people actually are able to achieve this level in their lifetime. Now we're going to talk about how we can prevent ethical distress. There are 4 R's that make it easy to remember. First, we must recognize ethical distress. We need to be alert to distress signals and put a name to their experience. Naming ethical distress allows for a greater awareness of what is happening and thus increases possibilities for resolution. Healthcare providers will be less likely to use negative coping strategies of distancing and escape avoidance that are often in the response to such situations if they understand the consequences of doing so. The next R is for refer. We must make a habit of regularly referring back to resources that address ethical codes and principles for healthcare providers, such as the American Nursing Association's Code of Ethics at ana.org. These codes can help clarify the concerns that give rise to ethical distress. The values of healthcare providers and the specific responsibilities associated with each value can serve as a guide for reflection and action. Knowing ethical codes and principles provides us with a roadmap in determining which actions we should take. Next is request. It is important that we not be afraid to request help and support. Healthcare providers who acknowledge their distress can find relief in discussing their issues with others. This dialogue can be informal or formal. Sources of support include peers and managers. When discussing with our professional peers, it is crucial that we stay focused on solutions for help, not on negative issues that can't be solved. Remember to try to stay positive, as negativity only leads to more distress. When discussing with managers, we must first find out if management is even aware of the problem. Perhaps schedule a formal meeting in which you can professionally present the facts with examples you've personally witnessed. Professionalism and good documentation are the key. At times, it's hard to ask for help, either because we're afraid that it will communicate that we don't know how to do something or that we might fail, or because we think nothing will be done about it anyway. Requesting help is such an important step in preventing ethical distress. When everyone on the floor works together as a team, helping one another, then everyone's level of work satisfaction will increase, while feelings of burnout and distress will decrease. Respect. Respect your colleagues when they are going through an ethically distressing time. Try to find out more about what he or she may be going through. Try offering help if you're able to during the shift. Let your coworkers know that you're there for them and maybe share experiences of how you overcame ethical distress in the past. Again, when units function as a team, realizing that all patients are our patients, overall outcomes are better for patients and staff and result in higher satisfaction ratings in hospital surveys and staff morale. And now some tips for managers. Managers, it's important that you remember to let your staff talk it out. One of the best ways to deal with stress is by talking about our concerns. Meet with your staff regularly through morning report or weekly team meetings, for example, and review caseloads and any questions they may have. Keep an open door policy for questions that your staff may not feel comfortable discussing in front of others. Next, help employees prioritize. Workloads can be much more manageable by setting goals and planning daily to-do lists to prioritize. Check with your staff frequently to make sure they feel comfortable with their patient caseloads. It's possible that duties may need to be shuffled or reassigned. Encourage regular breaks. It's important to take a little time to decompress and simply breathe. Encourage staff to take their lunch break on time and 10-minute breaks to avoid fatigue and burnout. Taking a walk around the building or leaving to go out for lunch can do wonders for stress levels by helping staff relax. Be a cheerleader for exercise and good nutrition. When the body is in good physical shape, it weathers stress much more easily. Offer incentives for accomplishing certain milestones, even if it's something as simple as creating a bulletin board in the break room that praises staff for their accomplishments. Encourage walking clubs where nurses can walk together outside or around the building during breaks. Stock bottled water and healthy snacks in nursing stations, such as bananas or granola bars. Use humor. Share a joke or a funny story during meetings or morning report. Healthcare is a career to be taken seriously, but having an environment that is too rigid can add to stress levels. Humor can help lighten everyone's mood. Provide a list of de-stress tips to your new hires. This can be included in the orientation packets for new staff. Consider leaving printed copies at nursing stations for reference. Include items such as meditation, yoga, deep breathing, exercise, good nutrition, talk therapy, and prioritizing. Next, we want to tell you about a program that you might think about implementing in the palliative care unit. This program is called Commit to Sit. The Commit to Sit program is an innovative program that encourages healthcare professionals to communicate with patients in a way that demonstrates compassion, respect, empathy, and competence in order to foster a trusting relationship. By sitting eye to eye with patients at the initial contact and spending time engaging in open dialogue and active listening, patients will communicate critical information such as allergies, past healthcare experiences, feelings of anxiety or fear, as well as important past medical history. High-quality communication between patients and healthcare providers is essential in establishing a therapeutic relationship because it can improve the quality of the information obtained during the medical interview and ultimately improve patient care. The benefits of effective communication in patient and family-centered care are associated with improved outcomes, greater compliance with therapy, increased patient satisfaction, and greater efficiency of care. Patients will require less pain and sedative medications as they become more comfortable and less anxious with their experience. While Commit to Sit is not a new intervention, it is an effective one. It is based solely on our patients' psychosocial needs. We know what you're thinking. I have 5 or 6 patients and so much to do. How do I find the time? It is difficult, but it is a commitment that should be made in order to provide quality care and improve the lives of our patients. Always remember your body language as well when interacting with your client during Commit to Sit. Listen to them. Make eye contact. Use the sense of touch, such as on their shoulder or their hand. Let them know that their health is important to you. We hope that this presentation has been a helpful reminder of the ethical principles involved in healthcare. It's time to recommit to provide the best physical and psychosocial care to our veterans. Remember to recognize when there are barriers to providing excellent care, requesting help when needed, and taking care of yourself. It's time for us to recommit to giving back to our veterans the way that they made a commitment to give to us.